Hello, Dr. Khayat. Welcome to International Dentist Podcast. So great to have you here with us today.
So happy to be here. Thank you for inviting me, Gabby. I'm very pleased to be here today.
I'll call you Sam if you're okay with that.
I want to call you Gabby. Of course, you call me Sam, please.
Super. So Sam, I'm really interested to know, and I really don't know much about your background story in terms of why did you choose the United States to, and when, how long have you been here, and why coming here for developing your dental career?
So I did my dental school originally in Lebanon. I'm originally Lebanese, even though I grew up in France. And I graduated from St. Joseph University in 2001. And, when you finish dental school, you really don't know exactly what you want to do. I was hesitating to do perio. Even I used to love orthodontics as well, but I always liked to be part and be the conductor of a whole treatment. So that's why I really kind of started to have focus towards prosthodontics. And I was fortunate to have a great instructor in Lebanon who graduated from Boston University, and they really gave me very good advices and really told me that it would be a good opportunity for me to go to Boston University. And the good thing was that the programs in the United States for postgrad are really full-time, great programs. So that's why I didn't want to go anywhere else. I was very eager to leave the country, come to the US and start something new and with a lot of excitement. So that's why I came in 2001. I was accepted to the PROS program at Boston University and I did my postgrad there.
So when you came, did you had in mind staying, or you just were eager to learn and then you were planning to go back?
I've always loved the US, so I kind of already had my mind already made that maybe I will try to stay. Even though I love Europe, I love France. In a way, I wanted to also maybe go to France. I explored this option before going to the US. The problem in France is the programs are not full-time. It's like 1 day or 2 days a week. And
so for every program?
For most of the program, besides, I think, oral surgery is a full program. It's a completely different system. Also, the fact that I got my dental degree in Lebanon would not allow me, even though I'm a French citizen, would not allow me to work in France. So I would just be in France and have only 1 day or 2 days a week of studies, and the rest of the time I wouldn't have anything. So to me, there was no question. The US was the best option. And that's why I picked that.
When you first came, because you applied for Boston University, that was your advice by your faculty. Do you remember applying to other schools as well, or you were very determined that that was the one?
I was very determined because pretty much a lot of my faculty in Lebanon came. We had a big group from Boston University. So that's why it was, to me, the best. And it was making more sense to go there because I already had some education from Boston University via my faculty members in Lebanon. So,
which I'm sure you also helped with your recommendation letters and all that because they were alumni.
Exactly, it makes it much easier as well. So that's why I decided to go there. I was maybe thinking to go on the West Coast, but it seems so far, the West Coast. Already, when you leave your country, even if it's like Lebanon or Europe, going to the East Coast, it's an easy flight to go back home. Going to the West Coast, make it like really much, much further away and much longer to get there.
Of course, especially being away from family. Did you came alone or you came with any family members?
So my mom came with me. It was fun. I call it my mommy moon. We spent a good month. It was good because I think the program started July 3rd, maybe just before July 2nd. So we arrived like 2 days before. And it was good for her to come with me because also she helped me a lot when I was in the school to look for apartments. So I have to say I have a very good memories of that time, quality time spent with my mother, actually.
So she probably helped you settle and make sure you What was good before going?
Exactly. Before leaving me, and we had fun. We still today we talk about this time. Like we can't believe it's been already 19 years. I moved to the US.
Wow.
Doesn't make me feel young at all.
Well, think about her.
I know as well. So, but it was fun. It was a very good time.
That's probably a very good experience to have, especially easing out a lot of the fears and challenges that you could experience when you first come here. Do you remember that?
You know, I remember very well the first day I arrived. Like when we landed to Boston, I was like, "That's it. I'm staying here now. I'm going to be at least 3 years there." I really remember stealing the plane how it was, and when we got there, and you know, you meet your classmates, and to me, the biggest fear when I get there was actually English.
Holy.
My English was horrible, Gabby. Like
I wouldn't imagine that.
when I tell today some of my friends from high school that I live in the US, they don't believe me because I used to be the worst in English. And, you know, I grew up in France until age 14. And in France, you don't really learn good English at all. Then I moved to Lebanon for high school for 3 years, went back 2 years to France. But in high school, like I was really me and another friend of mine that was in France as well with me. We were the worst in English. So it was very funny to arrive at BU and realize actually that there was such a variety of background from the other residents coming from all over the world, Japan, India, Brazil, Venezuela. So I realized actually my English wasn't so bad after.
What comparison?
We were all in the same boat, trying to understand each other. It was actually a very fun time. The US is always a very, and then any new country is a great experience.
Is it? I'm curious to go back to when. So you basically grew up in France and then went back to a little bit of high school, then went back and forth. Any particular reason why you end up doing dental school in Lebanon and now in France?
So honestly, I didn't think of dental school until I got into it. So when I finished high school, you know, you're 18 years old, you have no idea what you really want to do in your life. And I see now my nephew also was hesitating a lot about few things. So it's really interesting to remember this time when, what are you going to do of your life now? Now you're out of school. I was very interested into medical engineering. So I wanted to really build machine for hospitals and things like that. So I went to France. I did 1 year of what we call maths bio, which is a lot of maths and a lot of biology. And I realized that was not for me. So then I applied for medical school. I was always into the medical field. And in France, it's a very complicated and difficult and selective program. We are like 900 in first year. And at the end of the first year, they take only 90 people for second year. So out of the 90 people, they would take 80 in medical school and 10 in dental school. I didn't make the cut, to be honest with you. Then I'm like, do I want to waste another year or no? I wouldn't call that wasting because I learned so much about the way to study when I was those 2 years in maths bio and in medical school. A way to really, whenever you read, it's good to understand what you're reading rather than trying to learn by heart. So then I applied for medical and dental school in Lebanon. That's when I went back. It was 1996. And there you have to take an exam or you have 1,500 people applying for the exam, but that's to get into first year. So whenever you get in, that's it. You're in, you know?
Right.
And they will take 50 people in medical, 50 in dental, 50 in pharmacy, actually, out of the 1,500 people. And I make the cut. This time I was much more prepared. And even though I put medical school on first choice and dental second, I never had really interest in pharmacy, so I didn't take a first choice. I got accepted to dental school. To be honest with you, I was very disappointed. But then I realized that actually medical was not really for me. I'm more into doing like manual stuff, building things. I've always been fixing stuff in my house for everybody. So dental was really making so much sense, and I don't regret at all. Like, to me, I think the 2 years that I spent in Paris and the fact that I missed the medical school, it was really a blessing from the sky. So because now whatever I do, I just love it. I really love what I do.
Well, we wouldn't be here talking if that was the path.
Sometimes, it doesn't matter the route that you take, if it takes longer, as long as you found your way. And that's exactly what happened for me. And I discovered dentistry and I just fell in love with it.
Yeah, and it can, if you think about it, it help you merge all those desires that you have about construction and then engineering and all that.
Yeah. So it was at the end what I was looking for without knowing I was looking for that.
It found you. You didn't have to look for it. It found you. How was dental school in Lebanon? Do you think that experience helped you prepare for your journey here?
It's great. I realize it's such a great program. Maybe if I would say the only thing that is not so great is basic sciences. So we're not so strong over there in the school. Maybe also I was not paying so much attention to it as well. But in terms of clinical training and really pure dental training, we have a huge experience before coming to any postgrad. I think the experience that you get in a dental school in Lebanon, and at least the university at St. Joseph University where I was a great program, great faculty members, and you are so exposed to patients and you do so much. Like, you really do a lot of work. So I was very well prepared for that when I came to the US. And I didn't know until really I got to the US and I realized actually I had an amazing clinical background compared to other people or even American graduates who don't have the same amount of background. So it's really a lot of patients exposure before even graduating. So.
And that clinical experience is priceless. And I guess when you don't have like the pressure, like even, was it a private school or a public school?
The private school.
Private school. I feel the financial commitment here for dental students makes them focus. They really have a lot of distractions with dentistry. They go to school and they have big loans to pay. I guess the motivation of the school is slightly different, and they have a heavy load on basic science too. Which,
say, back then my class, we were 24 students in my class, and we get a lot of patients, so there is no much competition between us because it's a 5 years program in Lebanon, and so we were really roughly around 25 to 30 students per class, and there is quite a population who comes to the school to get treatment. So we are really a lot of exposure and really a lot of clinical training over there.
Do you have, or you notice any weaknesses coming in terms of maybe besides the basic science, any challenges in terms of the type of training you receive, or maybe the style on which dentistry was done there compared with here?
Not really. Really, it comes back to the language. And for a funny fact is actually because I grew up in France, I don't really speak Arabic. So
I didn't know that.
It's terrible like that. I cannot have a conversation. Maybe I will last 30 seconds or 1 minute, and then I will just won't know where I am. So when I was in Lebanon, my biggest problem was I was not able to speak Arabic to some of the patients who wouldn't speak French or English. My English was poor to start with, and my Arabic was even worse. So I was really speaking only French. So I learned the vocabulary in Arabic, the dental vocabulary. And then you come to the States, you have to learn a completely new vocabulary of dentistry. And I think maybe that's what we were not prepared enough over there. Is if you want to do studies in the US or any English spoken country, you're not really prepared. So it took me really my first year to really completely do the transition from French vocabulary to English vocabulary, specifically to dentistry. And funny thing is now reading a French article, it's easy because I forgot like what is a ferrule in French, like a pros and core, like they call it differently. So it's funny to go back. I remember those terms that I learned when I was in dental school. And so I think maybe the transition for the after could be a weakness, but I have to say, if to me it was a great experience at St. Joseph, and I don't regret any single day of it. So really, I had great people, uh, great students with me, and my classmates were awesome. So it was a great experience.
I think overall, if you have all that, and along with that, the mentors, like having good mentors that push you to like do things, right? So you're here because somebody told you go to Boston University and do
It really put me very comfortable because, especially I remember I had Dr. Booney who just came back from Boston. He used to live in Boston, and great prosthodontist. And I had to sit down with me. He's like, like you sit with your hero in front of you, and you're very intimidated, very shy. And even though now he's my friend,
I cannot imagine you being shy or intimidated.
actually I am sometimes. But I remember that his words were very wise and very encouraging. He didn't work so much with me when I was there, but he asked about all the faculty I worked with, and they all gave such a great recommendation that he really made me comfortable, telling me, you know what, I heard good things about you, and I'm really willing to help you out to really go to the US. And I started to work much more with him from that time. And he made it happen, and it's great, and I don't regret it at all.
That's awesome. And from the experience from your core residence, because with the multicultural environment, I think that's always at the beginning it's like an airport. Everything is fine. You're seeing everyone from all over the world. Do you struggle or do you have any cultural shock in that first year?
That was the best part. To arrive in a country like the US and realize that you actually have such a blend of cultures, especially Boston. Boston is such a great city. And I think that was also the main reason why I came to Boston in particular, because it reminded me a lot of a European style. And that blend of cultures is just like something that I think when people decides to come to Boston, that they have to know that they're going to be really immersed in so many different cultures. And I actually, that was the best part of it. I made friends right away. And it was nice to learn different cultures. I've never knew how was Japan, how was Brazil, how was Venezuela, how was Colombia. So many different backgrounds that you can talk about. And that's the best part of it. That's what actually helps you getting into a new life where you don't know anybody, that you really bond right away. Especially you start with preclinical, in pros. So you have like the whole summer where you stuck with your classmate, and really it's a small group because the other one are in the clinic or they're in vacation. And that was the best, I think, the best part of the program, the bonding with the different cultures. And I was lucky to have so many different cultures in my class. And I think that kind of like inspired me later on when I was a faculty to really try to recreate that mix, because that makes the best students, actually.
Absolutely. Let's take it to that. Then once you finish residency, and let's talk a little bit about your further experience. So you realized you wanted to stay. What were your options at that point?
So I had no citizenship, and I had no DMD program. So when I finished, BU offered me to work for them in their faculty practice, the BU Dental Health Center. And I did not hesitate. I actually, I was very excited and very happy that they will give me the job. So, but obviously you're an immigrant and you start to really have your own clinical experience on your own. So you're not supervised anymore, because I had zero experience as a working dentist or solo practitioner. So I went directly from dental school to postgrad. And so it was the first time that I was on my own treating patients. And I had one thing in mind, is I needed to get a green card and I needed to get my DMD. And that was really my focus for that. And one of the big things is to get the NERB exam, the NEBD actually, the board exam, sorry, before even getting to the NERB. So those were my three focus whenever I graduated in 2004. And it took time. The board, when you are 28 years old and you have to go back to basic sciences, it's not easy. And I know everybody around me, we're all in the same thing. It was the most difficult part was to get the boards. And
Especially part one. Part one is particular.
yeah, part two is a piece of cake. And it's all microbiology or physiology, all the things that you realize, I mean, why did we learn that? I mean, yes, maybe it's useful, but not so much at the end.
And many of those things, and in Venezuela it's the same, we don't have a strong basic science foundation. So many of those things were completely new when I studied for that. It's like first thing I'm reading about these things that maybe medical students do, but it was completely new and unfamiliar.
Imagine in English you have to learn that.
In English, and 20 years after you finish dental school, right? Or at least 20 years after I started dental school. So
I know. I mean, I took it, my second year of pros, I took the board without studying, just to have a feel of it. I remember I got, I think, 71, which wasn't so bad, actually, to get 75. But, then it took me a while to pass my boards. And that was the main focus in 2004. It's tough to study for the boards when you are in pros. Obviously, you've been through the pros program, and we are in the school from 7 in the morning until sometimes 2, 3 o'clock in the morning. So it's long hours in the school when you're in pros. So it was impossible for me to really study.
yeah, it's I share that experience myself from it took me 2 years just to get the boards done because it was just a matter of trying, then failing, and then trying again. First time, always you go just to check what it is like to have a 400 question exam sitting in a chair for 8 hours like that. Which I guess it's the same for you. We're not familiar. I wasn't familiar with this type of test or with this format. Yeah, unnecessary stress, but we all get through that. So once you kind of clarify, sorry, those were your priorities to get your green card and then get your DMD and then study for your boards. You pass your boards and you start working on the EU faculty practice. What happened after that?
So I worked for BU from 2004, full time from 2004 till 2007. And as you know, you can have a faculty advanced standing program usually, but back then there was a change of deanship and there was nothing happening at BU. I love my job there. I love the practice. I love the people I was working with. I love the director, Dr. Erente, who was also really great at supporting me and everything. But I needed to look for an option so I can start to really unlock my potential to be able to stay in the US. I knew there was an opening at Tufts University, and I did meet with Dr. Chapman back then, and Dr. Nui were there. And I had a meeting with them, an interview. I guess it went well. I didn't get a job offer right away, but then I think a month or 2 months later, they contacted me back to go back and re-interview with them. And I have to say, I was really lucky to have Dr. Chapman as a chairman back then. He was really a man of his word because I made it very clear to him. I'm like, listen, I'm doing well at BU. I'm happy, but there is one thing that is lacking is I want to make sure that you guys will sponsor me for the green card. And I want to be able to enroll into the faculty advanced standing program. And that was really my conversation I had with him. And even though he left, I think a year after I got hired by Tufts, he made sure that he was going to honor his word. And that's something that I will never be able to thank him enough. I haven't seen him since then. Really, but he was a great guy and as a man of his word. And that's what really kind of made me the transition from BU to Tufts. And, I still had, as you might know, I was the BU guy when I came to Tufts University because I wanted to keep the faculty practice. So I used to work 2 days at BU and the rest of the time I was at Tufts.
So they let you work in the faculty practice without being a faculty.
No, I was still a faculty at
Okay.
I was a faculty in both schools actually, which Tufts did not like much at all. But that was my condition. I wanted to keep practicing. I didn't want to be 100% teaching. I wanted to be able to still see my patients at the BU faculty practice. I didn't want to start over in the Tufts faculty practice, and time gave me a reason because the Tufts faculty practice, I don't know, does it still exist actually? I'm not
No, they're close. Yeah.
close, yeah. So it was a good thing that they allow me to do, even though some people, I don't think they even allow it anymore to be in the two schools at the same time.
Yeah. Now that I'm aware.
It was great for me. I had a crazy schedule. Back then, I didn't have kids. I was not married, so I could spend the time between BU and Tufts. And it was, I think, one of the best things that happened to me going to Tufts, because really, they really gave me everything I needed, and I had a great time there. I spent 1 year in the UG program. Then Dr. Al-Wazan told me if I wanted to be with him in the aesthetic program, which really opened a brand new door for me. And I'm really thankful for him for that. And then he left and I stayed and I took his position. And I started to work with Dr. Hirayama, which was a great experience. He really gave me full control of the postgrad aesthetic program. And not only it was exciting for me to put a whole program together, but it was good to be able to really tailor the program the way I wanted with the full support of Dr. Hirayama. And that's when I really became to be very involved with Tufts. Gradually, I decreased my time in UG, and then I was pretty much all the time in PG. But I still kept going to the BU faculty practice all this time.
Wow.
Until 2011.
Oh, wow. I had no idea. I knew even when I heard about you, because I started in 2011 at Tufts, you were still the BU guy. I can remember you. You were always the BU guy at Tufts.
No, I'm going to be honest. I mean, the one thing that I'm disappointed with Tufts is the BU Tufts relationship. I mean, I know there is a history. We're not going to go in detail about that. But, when I was at BU, I never look at the Tufts people as being the bad guys. I've always been a very respectful relationship between residents. And I know because I became friends with people who were at Tufts. And when I came to Tufts, I realized that really at Tufts, they really don't like BU people. And, you don't really judge people from the university they come from. I've been always a hard worker. I always give every second I could to Tufts University when I was there. I enjoyed it. At the end, it paid off because they really were grateful for my work. And but that was the only thing that when you say you're from BU, it was like really not well seen at Tufts University.
Yeah, I don't know why. I know there's a story and probably a long story behind it that we don't get into much details, but I agree with you. I felt the same when I was a resident, and maybe because of my personality, I was always hanging out with the BU residents to the point that actually people thought in the meetings in ACP that I was from BU because all of my friends were from BU, and there was, I guess, a bigger Venezuelan community than what I had at Tufts.
It's true.
Yeah, but I shared that with you. I think eventually that should go away because history is history. And whatever happened.
Great to bring someone from another university. You bring different ideas, different background. That's the beauty of it. Actually, it worked out well for me at the end because then I was able to put the aesthetic program together in place, and I enjoy. I worked for Tufts. I think I'm trying to remember until when 2013. I think 2014.
How long were you program director for?
So I was from 2009, I think, to 2013. I'm not even sure about those dates. Actually, before 2013, because then I bought my practice in Hingham in 2013. Yes, actually. So then we brought in Dr. Shabib to take my spot. And that was when I was actually starting to work in private practice. Yeah. And it's it's a great time. Tufts, I mean, I think it's the best thing that could happen to me, because really I learned so much actually at Tufts. Putting a program together, you think you know it all, but actually you learn so much on the way, and that was a lot of fun. That was really a lot of fun.
So did you had any experience with leadership roles before that prepare you for that position, or what do you think it made you like capable of dealing with that? I know personality plays a role too.
Yeah, I mean, I used to be the class rep in my class when I was back in Lebanon. I was always class reps. Lebanon, in the US, I was the one in my BU Pros program. I was a class rep, so I always like to be involved with things, and I like to do sometimes things my way, but I like to listen as well. It was a good experience. It was a great opportunity. You get to put. I had zero actually experience on putting a program together, but I had a lot of ideas that I shared with Dr. Hirayama, and he was totally in. He gave me actually really full control about doing whatever I wanted. And that's why I really liked working with him, because he never really got so much involved with me. He let me do my stuff. He saw that it was going well. The students were happy. The school was happy. The finances were happy. So, I had all the markers on the green for me. So I kept going and I enjoyed it.
Yeah, with all the checks, like good.
And I love teaching. It's something that I love to do. That's maybe the one thing I miss right now in my career is teaching. But it's fun to have your own class. That's a dream, like from when I was a little kid. I hear my kids now telling me they want to be a teacher. And I remember I was like that because you always have one teacher that really you admire, that you really inspire you to do teaching. And obviously, when I was a kid, I didn't think I was going to be a dental teacher. But being able to hang out with those students the whole day and share your experience and listen to their own experience, because you learn a lot from students, actually. Mm-hmm. I learn it. Still today, when I work on a patient and I do something on a specific procedure on a patient, I remember who's the student who taught me that trick, or who's the faculty I learned this from, so you always remember. Like the way I prep a tooth, I know exactly what faculty taught me that. The way I floss sometimes to clean the cement. One student at Tufts taught me to make the knot and then clean the cement with the floss. So you learn a lot. It's a good experience to be surrounded by students and great faculty around you.
Absolutely. If I ask you, and I know this is a difficult question, but if I ask you who in dentistry inspired you to be a teacher, do you have a person that you look after?
In dentistry, really, it was at BU. And I had two teachers who inspire me, actually. The first one is Dr. Yamamoto, because he's like a talented person. He's really good, great hands, very patient. You have always a line behind him to wait for your turn to work with him. Really a great clinician. So my goal when I was a student is like, I wanted to be able to prep a tooth and make sure he doesn't have to touch it after I prep it. And I still remember the day I did that he came to check my prep and he's like, good, take the impression. And I'm like, you're not going to re-prep it? It's like, no, it's good. I'm like, yes, So that was the fact that he spent the time with his students. That was really great. Another faculty that really inspired me a lot is Dr. Daryl Roy. And that's because he was so much fun to work with. So on the fun aspect of being a teacher, he inspired you because he used to be a volunteer. He would come only on Fridays. And it was really so much fun to work with him. There was that relationship between the students and him where, there is no hierarchy. It's like he treats you, looks at you at the same level. He's not condescending. It's like really at your level, and you laugh a lot with it. And that's what I really wanted to provide when I'm with my students, to be able to spend the time with them for the teaching, but at the same time to make the experience fun. And that's really kind of those two faculty that really inspire me a lot in the way I teach, actually.
And I can tell you that you definitely accomplished that mission of incorporating those things on your teaching style, philosophy, whatever you want to call it, because I remember being super impressed, shocked, positively impressed for seeing you, how committed you were to your students, how they were like still respectful. They will still follow, they will commit to do their best, but at the same time, they felt like you were a friend.
Exactly. And that's the way I felt myself with this faculty. And that's why I wanted to have my student feeling the same with me. Obviously, you always have to draw a line that students should not cross sometimes, or faculty should not cross. I mean, there is respect, but there is also fun. And when I have so many of my residents, they became my friends now. So I see them outside the school, and I love that, because it's really, we always talk about those fun moments in the clinic or during a lecture or whatever. So, and it is a feeling of accomplishment that really, as a faculty, it's nice to feel that it's really like to be able to still connect with your students after they're gone. It's, I think, the most rewarding experience that you can have.
I agree. And there are a lot of things that I noticed myself doing and applying, of course, from many people that I learned. But I always remember you being in the clinic very committed, and your students always being like feeling so great about you. It was really one of those things that I wasn't familiar. Of course, my director was Dr. Hirayama. So my experience of director was completely different. I couldn't come and just joke with Dr. Hirayama as much as eventually I did. It took me a while, but
it's actually very funny.
He's extremely funny.
That's the fear factor, with him. That's the thing, people are fear. And he loves to play that fear factor. Right?
Absolutely. He keeps it as long as he
You see, me, I've never had him as a student. So when I came was as a faculty, so I didn't have to go to that fear. But yeah, it's, being a faculty, obviously, if you commit to the students, like you really want to make sure that you teach them, that you feel like you do the job. And I remember the students used to see who will keep me the longest in the clinic at night. So like I started 10:30 at night once. I stayed with the resident. But then, then I got married. I had kids. It was a different dynamic for me. I was not going to stay so late in the clinic. But yeah, the bonding between the faculty and the students and this interaction is really the best thing you can have as a faculty. It makes your job fun, to go and have to be with students that don't like you, that are not motivated, don't want to learn. Obviously, I've had few students like that. But I've had other students who also were terrible clinically, like they have terrible hand skills. That also makes it very difficult for faculty, but they were so eager to learn. And it's amazing to see that their hard work will pay off by the time they graduate. And I really work with some residents who had zero knowledge, but by the time they finished their program, they were so good that I would be comfortable having them as my dentist, because they really work hard. They were there for a specific amount of time. They wanted to take advantage of every second out of it. And that makes you very happy as a faculty to see those hardworking students who are never lazy, never complaining. They recognize a mistake. So that makes a big difference as a faculty to work with those people.
It helps a lot, the process, because then you know that they recognize that you are doing on their best interest. Like if you're being hard or if you're really pushing it. And it all goes back, I think, to the motivation of the student. And you mentioned motivation being a big factor. Some people come with like motivation levels up here and they slowly go down. And some people actually get motivated as they learn, because learning it gives you empowerment. So you feel that you can guess control more and the more you learn.
When I came to the US, when I had the choice between going to France or the US, French studies are free, basically. It's free over there to do your postgrad. The US, we know it's very expensive. And I was lucky enough to have my parents who were able to pay for my studies. And when I came to the US, I wanted to make sure that every day I would spend in this program, I would then make my parents proud that I worked hard to really get what I wanted and be then a good dentist and really make them proud. That was the motivation. I didn't want to feel that they wasted their money, that I had zero motivation. You want to learn? No. For me, every day was important. There were a lot of sacrifice. I mean, back then, I remember the tuition was like started at 32 grand. By the time we got it, it was like 38 grand. Now I think it's like double the price, 19 years later.
Yes.
Which is crazy. But, I was lucky. I was able to be a sponsor. I didn't have any debts by the time I finished my program. And I wanted to make sure my parents were proud. So, and I think they are.
I'm sure.
Guys, proud, dad and mom. I hope so.
I'll find a way of getting this to them so they can answer, but I'm sure they will. I will, that if I were them in that position. Thinking of motivation, because you were in the role of a program director for a few years. What do you notice in the process of selection of applicants? I wouldn't take it back to people trying to get in the system here. What do you think it makes a strong candidate?
So honestly, it was mostly the interview for me. Like, I mean, I don't know if you've been in the interview process as a faculty, you know how it works. You can have, to me, grades in dental school don't mean so much, unless obviously someone applies has only F grades. Yes, it could be a problem. But okay, if you don't have straight A's everywhere, but then you have a good personality when you come at your interview and you show motivation, that was really, to me, what I was looking for. I was looking not only for that, so I wanted to have, and I always took in consideration the fact that you can be nervous at your interview. So you might not be yourself. And if I have to make a recommendation to all the students who want to apply to a school and they have to go through the interview process, just be yourself. Really, because you don't want to be fake. We can sense when a student come in, is just so fake, try to please you, whatever. I was not looking for that. I was also having an idea about the hand skill, but to be honest with you, I took many students who had terrible hand skill, but the bond happened the day of the interview. I could tell they had a very good motivation. They had a great mentality that they were here to really learn and to get the most out of it. So those are the students. And also I look into diversity of my class. As I told you earlier on, I had a class that was very diverse. Sorry, I lost you. I had a class that was very diverse. And I was trying to recreate that for my students, because I realized that when you bring people from different countries, different cultures, it works so well together. And my best classes were the most multicultural classes. And those are the ones I also had so much fun. I'm not saying that the other classes were not good, but it does make a difference when you have so many people that they are all in the same boat. They're coming, they meet new people. There's such a huge group motivation that happens. So those are really like the criteria I was looking, trying to create a diversity and at the same time making sure the people were matching kind of like the personality I was looking for. The grades were the last thing I was really looking at.
Yeah, I think now you mentioned that, something I learned very well was how hard it is for the director to put together a group that it will work well together. It's a little bit like a lottery, right? So you're picking people by personality traits and culture, backgrounds, experiences. So in a way, everybody can complement each other and put together a group like that. Now that I look back, I mean, I thanks Dr. Hirayama for putting together the group that he did for my class, because my class made my experience 200 times better. Please.
That's the whole point. And I think it's not only when you go to postgrad studies in a new country, you're not going to be on your own. You actually being in a group where you can really exchange experiences, and that really makes you better. The group together, if the group goes well, you have a strong class.
Absolutely.
Then you have faculty member enjoying teaching that class.
Absolutely. And it's something that is hard to put in paper, right? So when you look at through applications, you're never going to have that's a requirement being diverse or having certain characteristics, right? So I think it's important for the applicants to know, or for people applying to any program, that there is a component based on personality, that you might be a good candidate, you're just not the right fit for that program.
Exactly. You might have the best grades, but if you're not going to get along well with your faculty member, you're going to have a horrible experience. So that's why, I mean, being declined from a program doesn't mean you're not good at all. It's really putting a team together. So sometimes you need the best player to put the best team together. And that's exactly what I did when I was selecting my class, my residents. Is I was trying to see, okay, how will this team work together, and how they will work with me also, because I would be the one spending the most amount of time with. And I think that's, I mean, we do make mistakes sometimes. Maybe sometimes we miss a good opportunity of a student. We were not able to read that student well when they came for the interview, but most of the time, actually, you end up having good teams. And I had a great time being part of this program. Like that's really, I miss that a lot. I know I will get back to that at some point, but I do miss the teaching a lot.
And we miss you. We miss you as well. But I'm sure that wasn't an easy decision to make, to switch completely into practice. How did that happen?
So I bought my practice in 2013. I used to work since actually when I got my DMD in 2011. So toward the end, November 2011, I started to work as an associate in this practice. And so that's when I started to cut down my time. And that's when I stopped BU completely, because the 2 days I was at BU, I was now in private practice. And then I was offered to buy the practice. And obviously, when you become a practice owner, your priority change. And you cannot just be 3 days, 4 days in school and leave the practice run on its own. Especially, I'm a solo practitioner here. So my wife works with me, but she's a periodontist. So as a prosthodontist, I'm the only provider here. So it was a natural decision to cut down the school. I was trying to keep my Fridays for the school. So at the beginning, I was going every Friday. But then we started to open the practice on Friday, because the practice I bought was only open 4 days a week. And as I started to build up the practice, I started to build up patients on Friday, mostly for my wife, so to make it a peri-op practice. And then I got too busy. I had to be here on Friday, so I became a volunteer. It didn't work out so great, because it's tough. Sometimes there's so many things that happen that it's tough to commit to the school when your practice is running on Fridays. So little by little, I faded out from the school.
And I'm sure that you're experiencing a new facet in your career right now, being a practice owner.
It's great. It's great, but it's not so easy. It's not, you have up and downs, especially the beginning when you buy a practice. If you don't talk to someone who bought a practice before, it's going to be a difficult experience. So I learned that. I mean, I was lucky to have some people who are practice owners who helped me, but still, I think you really have to sit down with someone so they can share their experience as a new practice owner. because you're going to start seeing patients. You know, when you buy a practice, some patients decide to leave. This is a phenomenon that you don't understand. You don't even see the patient. You've never seen them, but because they found out the owner left and the new owner is here, they would rather go to a complete different place rather than getting a chance to that new dentist in that same building. So it's tough on a personal level because you feel that every time you find out the patient asks for their records and you're like, did I do something wrong? Oh no, I've never met that patient. Oh yes, I've seen that patient only once. So you got to accept that you cannot please everybody. And that was probably the first year of ownership is the most difficult, actually, because that's when you're going to see the trend that you do lose some patients that you never met and some that you did meet. But you take it as a personal failure. But actually, you realize that it happens in every single practice. So when I have a boost here now of a new patient, suddenly they all come from the same practice. I know that there was a change of ownership in that other practice. Know what I mean? So it's a funny thing that happen in patients' mind, but you got to accept it and don't take it personally because now I'm 7 years into ownership and I just love it. It's my little baby, you know. So you see, before Tufts aesthetic program was my baby. Now my little baby is my practice, and I love to be here. I don't regret every second out of it.
That's great. I guess probably every country is different. Something that I was shocked when I came here in terms of practice is that most people buy practices from other people versus starting from scratch. So, and that I was really not familiar with what are you buying when you buy a practice. Like, are you buying the space? You're buying the people. You're actually buying the people. You're not really.
You buy the patient pool, pretty much. You can buy the building. I bought both myself, the building and the patient pool. So you buy the business. And, but you know, you cannot just stop there. It's not because the business is doing well that you're going to buy it and it's going to keep doing well. No, you're going to have to impose your style, create that loyalty from the patients. And yeah, the first year is the most difficult usually because for the patient's mind is a lot of change. But then after 2-3 years, you start seeing the trends that you're getting more and more new patients that were referred from your current patient. So it feels good to see that, and that boosts your motivation to keep going. And you know, I bought the practice. It was stuck in the 80s, that practice. Like, I'm talking really like furnitures, chairs, like, all the cabinets. So little by little, I've been putting it into my style, renovating, upgrading, and patients, they love that. They really love that. They see that, you're investing into their quality of care as well. So they enjoy that a lot.
Yeah, and you end up attracting patients that will feel connected with your style as well. Because at the end, the patients go there for you. Like, regardless where you are, they will follow you no matter what. So the people will follow other dentists. If they're retired, they might explore other options. And that's just not about you. It's just about them and their experiences.
Exactly. And it's a great thing. I mean, I know where you come from, where I come from. We usually start our practice from scratch. So, you know, and you can do it here. And I know some friends who did it and they succeeded a lot. So, I think it's easier to buy a practice that exists, even though there's going to be a tough first year usually. But then you make it happen. It's a lot of work. It's really like being with a baby.
I'm sure there's a balance between, like, yeah, babies are demanding, right?
I know. Well, practice is demanding. It's a lot of work. It's a lot of work at the beginning. Now it's good. Now, you know, it runs smoothly. I'm doing much less administrative work. So I get much more time for myself right now to focus more on the dentistry and then try to be out on time. That's good.
How long do you think it take to get to this point that you're feeling comfortable right now?
So it does have to do a lot with the team around you and your office manager and the dedication of the people around you. So it took me time. It took me about, I would say, 4 or 5 years to really start delegating more and more my own administrative work. Because before you just want to micromanage, and but at some point you just want to let it go. And I think it also has to do with your personal life. Personally, I said my kids are young. I mean, now they're 6 and 8, but I don't want to spend my whole evening in the office when I could just be hanging out with them and have spend like family time. So that's a good motivation to start loosening up, delegate your administrative work to other people, but you just have to spend the time really making sure they're doing it your way.
Of course.
So you do have sometimes to accept their way. That's actually something you learn that, okay, you got to listen and make sure, as long as the result is the same, or it's even better sometimes. But yes, there's always some conflict with your team member, and it's part of any business. That's the team around you is important.
Yeah. And it's also education too. You are to educate your team and they might teach you one or two things too. So
I would say the first 2 3 years you spend a lot of time building up the team loyalty to you. And I'm lucky to have, I have a small team. My practice is small. I have 3 operatories, one being for hygiene and two for me. I really build up people who have been with me from the beginning, and being able to work with those people that they are loyal to you. They don't think about just shopping around to find another dentist that will maybe pay them an extra $1 an hour or whatever. There is a very good respect between me and the team member, and great loyalty. That's important, I would say.
that's priceless. It's all about relationships, how you build.
Yeah. That's the most important, actually. To have a headache-free business is build up good relationship. Same thing you do with your students. You can be friendly with them, but at the same time you build up respect. You draw a line, and everybody they do whatever they have to do. In a good environment.
Of course, an environment that is safe, that it makes them feel empowered to make their decisions and supported, like you were once when you were program director and you were given independence and autonomy to do your things by Dr. Hirayama in this case, and so on. It's great.
That's exactly what it is.
So Sam, like looking at all your career experience so far, like you really navigated pretty much every area that a dentist could do here. You did practice teaching in 2 different universities, faculty practice, now private practice. Then you combine for a little bit teaching and practice. Looking back to all of that and coming from a different country with a different background and experiences, if you could look back and reflect to everything that you learned, if you could talk to the little Sam under 20s coming to the US, what piece of advice would you give to yourself?
Learn English. No, really, it's a tough question you're asking, because I don't think there's so much advice you can give, but at the end, everybody grow differently. They have different experiences. So it's a tough question. I was very nervous when I came, but at the same time, you have that mix of nervousity, but excitement to start something new, leave your nest, your parents or whatever, and be on your own. If really I had to do that again, probably I would try to focus. If I knew I was going to be and staying in the States from the beginning, try to focus on the things you can do while you're still young, and like studying for the boards, all the things, working on your green card, working on the DMDs, all the things that kind of like not slow me down, because I was working and I was enjoying what I was doing, but it's tough. I don't know what to tell you. It's just not to be feared of moving forward, really. And I think I would tell Sam, listen, little Sam of 20 years old, that you're going to do great. You're going to have fun. That's exactly what I would actually say. Don't worry, there's going to be up and downs, there's going to be bumps on the road. But at the end of the day, you're going to be happy of what you achieved, and you're not going to regret every second of it.
I love
That's what I would say. That's what I would say, yeah.
that. Sounds like what you will tell to one of your residents. So the sound of all right.
Well, exactly, yeah. And it's true, it's true. Nothing goes always as smoothly as you would like to, but everything happens for a reason. So that's what I believe. And I can't complain. At the end, it turned out good for me so far. And even though I had some tough times, wedding and failures for boards, for getting a green card, for those things, or in other schools. So that's why, like, it's going to work fine if you perseverate, you say in English?
We're still having some English trouble. Where's the
Sometimes my English, my French comes back. I mean, I remember one of my kids, I told one of my son, I'm like, be careful. And I don't even know which one I said. I said, be careful. This is fragile. I'm like, Dad, we say fragile, not fragile. I was like, okay, sorry.
we're at that stage now that the kids are correcting your English. So.
Exactly. So yeah, but yeah, I would do it all over again, honestly.
That's I think the biggest motivation, feeling that even with all the challenges and everything, you'll repeat the experience.
Exactly. I think even when you're on your down part, then good come out afterwards. So you don't want to miss that good, you know. So you have to go to the bad to get to that good. So I will do it all over the same, really the same.
That's awesome.
Yeah.
Awesome. Well, thank you so much for sharing a little part of your story with us today. And if you have any final thoughts or any message to the international dentists out there, Mike is yours.
You know, it's a great journey to come to the US. And I think we all in that same boat. We all trying to stay to the US. It's to me, put your fears away. Just, it's okay to fail sometimes. It's okay to have some failures. But if you're really motivated, everything is going to work out fine. I mean, you're in a country where the education in postgrad program is excellent. For work, it's a great country of opportunities, and it's fun. I mean, really, the one thing that I miss myself in the US is my family. So I'm not lucky to have my parents and my brother and sister and the rest of my family in the same country. So that will be the only thing that, yes, I miss is my family. But you know what? I go see them once, twice, even more a year. That makes even the time more enjoyable and a great quality time with them. But yeah, don't be scared to come to the US, even though the start might be a little bit bumpy and tough. But it's a great place to learn. It's a great place to blend with other people and to really learn so many different cultures. And I think that's what is the best thing about coming to a different country, especially like the US, where you have such a mix of culture. Boston in particular, I learned so much. Makes you want to travel the world when you meet those people from all around the world. Actually.
It does. It is. It's a priceless experience.
I have a bucket list of places to go, and really, I want to discover all those wonderful countries where all my friends are from.
And you have a house and tour guide in every city. So
that's true. There is always a place to crash in pretty much almost every country in the world when you have so many friends from so many different countries.
That's fantastic. It's right. That really has no comparison. I agree 100%.
Part of the whole experience, actually, really. the friendship you develop with all those people from different backgrounds.
Like everything, it's all about people. So we all go back to people.
Exactly. You don't want to come here to be alone and not embrace the culture surrounding you. You got to come and really open your arm and embrace everybody, every culture that is surrounding you. That's my way of living, actually.
Absolutely. Thanks again for sharing. I'll let you go for today, but
thank you so much. It was a pleasure, really an honor to be here. And thank you for everything you're doing. It's, I can say something about you, actually. She's a great person to work with, Gabby, for all who are listening to us. I'm lucky to be part of the ACP Massachusetts section. And Gabby, you're doing a fantastic job in this. It's a delight to work with you. And really, and what you're doing with the International Dentist podcast, it's such a great initiative. And I really wish that it's going to keep going on and on for many years to go.
Thank you so much. I hope so. And it's been great working with you, learning from you. And I hope we continue to do that.
I hope so. Thank you.
Sure. Thank you.